The future of healthcare in Oklahoma was the topic of the latest Watch Out program conducted by Oklahoma Watch. The guests, Julie Cox Kane, the Deputy Secretary of Health and Human Services, Craig Jones, President of the Oklahoma Hospital Association, and Lou Carmichael, CEO of Variety Care, discussed the issue and took questions from audience members. Here is part of that discussion in this ONR Extra.
But if you ask people what needs to be changed, those answers fall into three buckets. Access, how many people are going to be covered, the quality of care, and the cost of care. And I challenge you, as you're driving home, in the shower, or whatever, you can take any two of those and you can get your arms around them and you can handle that pretty well. Let's say we want to give everybody health care. And certainly if we're going to give everybody health care, then it needs to be of a quality nature. But then the third element of cost comes in, and suddenly the cost is exorbitant. And you can play with those. But that's what we're challenged with.
We talk to ourselves real well with the electronic health record, but we don't talk among ourselves with the hospital and emergency room and other pieces of the healthcare system. And so that communication and coordination must improve if we're going to do the three things that we all know we have to do: increase access, decrease cost, and improve the overall health of our state. If we don't do those three things, the healthcare system cannot sustain itself.
The legislature in Oklahoma is considering a $1.50 per pack increase in the cigarette tax. It'll prevent almost 30,000 kids from ever picking up smoking. We've run the numbers on the healthcare claims. So for the claims that are in the commercial insurance market in Oklahoma, if there's a smoker in there, it costs them 3.5 times per year, every year. On the expenses that come through that insure for a smoker versus their average insured life. So if we want to reduce healthcare costs and we want to save kids today, the legislature could pass a $1.50 per pack cigarette tax increase.
In our state, 1 in 3 babies are born on Sooner Care, which by definition means their parents are poor, right? So we have to think about not only health